welcome everyone again to another lecture which is about the anatomy of the ear, and I'm expecting at the end of the lecture to achieve these objectives. So when you say the anatomy of the ear, I think what comes to your mind from the basic that you have, that we have external ear, we have middle one, and we have internal ear. Yes, this is the external ear, and this is the middle ear, and most medially, this is the inner ear that we call it sometime labyrinth. Now, let us start with the external ear. Of course, you are familiar with these two parts of the external ear. Once part of it exposed outside. So the external ear formed by the auricle and the external auditory meatus or external acoustic meatus. So let us have a look to the auricle. Yes, this is the auricle in which this curve, there are a couple of things here, 4 or 5 things. I would like to make sure that you got them. So the this curve posteriorly known as helix, and another curve but smaller than that and anterior to it and parallel to it called antihelix. So this is the helix and this is the antihelix. On the other side, you have anteriorly this process, which is the tragus, and opposite to it you have antitragus. Furthermore, you have this area here, this kind of what we call it the concha, right? This part, this groove, this depression called the concha. Now the last thing is the lobule. You know that the auricle is composed from elastic cartilage exists there, except this part, the lobule, in which it is just fat filled with skin. So the auricle exists outside, which is like a satellite to I would say collect the waves and sound vibrations, right, and collect them in a way or another, and of course when they collect it, it becomes like better for your hearing. So as I mentioned, it's composed from elastic cartilage. That's why it's flexible, covered by skin, and of course in the auricle there is an insertion of extrinsic muscle like anterior auricular, posterior auricular, and superior auricular. Anyway, these are such a rudimentary muscles, so they participate in a kind of movement to the auricle, but minor. You can ignore it. So of course innervated by facial nerve. Anyway, so most importantly that the innervation, the sensory innervation of the auricle. Well, I think you know that from trigeminal nerve there is a branch from posterior division, of course, called the auriculotemporal. Listen, auriculo, that means something related to the auricle. It passes in the here, in the front of the auricle. So the auriculotemporal, this is the temporal area here, right? So the auriculotemporal nerve, which is a branch of V3, carries sensation from the most anterior part, the yellow color, right, of the auricle. While you know cervical plexus gives the great auricular nerve, from its name, the auricular, great auricular, from C2, C3, to carry sensations from this area, while the posterior nerve, nearby the occipital bone, there is another branch of also cervical plexus called lesser occipital. Lesser occipital. Now the auricle itself, now simply I can say innervated, or the sensation from there, carried by 2 nerves, vagus nerve and facial nerve. Mostly in the center, you have these red triangles, is the vagus nerve here, right? And peripherally on the auricle, you have, of course, the the facial nerve. So cranial nerve number 7 and in the center number 10. Now, when you talk about the external ear, it's not just the auricle, but it composes from the auricle and external acoustic meatus or external auditory meatus or canal. So the external acoustic meatus, it's not like straight as you see here in this figure. It's not like that. It's curved anteriorly, then a little bit posteriorly, then again anteriorly, of course upward. That means when you go to the ENT physician, you expect like the physician once he or she wants to have a look there to the eardrum using the otoscope. So he or she has to straighten the external acoustic meatus or canal. So how he or she can straighten it? By this, which is very important. He or she has to pull the auricle up posteriorly and out laterally. So superiorly, then posteriorly, and then a little bit laterally. By this way, the external auditory canal straighten as much as it can, right? Or as possible. So back to the external acoustic meatus that you see here. Look at the canal itself. Look how it's composed from what? You have to know. Yes, we said that the auricle composed from elastic cartilage, right? That means you expect that the outer 1/3 of the canal or the meatus, external acoustic meatus, composed from cartilage, right? The outer 1/3, while the medial 2/3 or the inner 2/3, let us say, is a bony part, which is opposite to the Eustachian tube, right? Okay. Now, furthermore, if you look here at the skin, in which the outer 1/3 here gives like a site for hair and sebaceous and seminous gland that of course secrete yellowish brownish substance, what we call the ear wax, right? Secreting the ear wax. While also look at it here, the tissue here, the skin covers the bone, and not just cover it, it adheres directly to it, in which there is no space for any swelling there or any pump built there. And so if you have even so tiny pumps in there, you get so much pain because there is no space for the abscess or pus to accumulate there. The skin directly connected to the bone, right? Okay, now before finish the external acoustic meatus, let us define the innervation of this canal. We said that yes, the facial nerve here, and here we have the vagus nerve, and we mentioned there is a nerve here called auriculotemporal nerve, if you remember, that innervates the auricle from this side anteriorly. That means we are very close to these nerves, and the external acoustic meatus innervated by the auriculotemporal nerve and vagus nerve mainly, right? And with a minor contribution from facial nerve, the same nerves that we mentioned before. Okay. Now, the auricle, the drainage from the auricle, which is very easy to remember, right? The anterior part, which is close to the parotid gland, you know, there is superficial parotid lymph nodes. So the lymphatic from the anterior part of the auricle drains into these lymph nodes, superficial, superior parotid lymph nodes. Also, of course, they are superficial, right? And the posterior part of the auricle drain, you know the mastoid process there. So there is also mastoid lymph nodes. So the posterior part drains into mastoid lymph node, while the inferior part or the pule drains into superficial cervical lymph node, right on the neck, on the surface of the side of the neck. Okay, now this is the that was about the external ear. Now let us shift medial from external ear to this cavity that known as middle ear, or we call it sometimes tympanic cavity. You can say middle ear and you can say tympanic cavity. Middle ear is most common, I think, but anyway, you have to know both, because this room connected anteriorly and posteriorly, it has two doors. The anterior door connected with the nasopharynx. So this tube, we call it pharyngotympanic tube because it connects the nasopharynx with the tympanic cavity. That's why it's called tympanic cavity, right? Also called the pharyngotympanic tube, called Eustachian tube or pharyngeal tube. Anyway, indeed, the what's the what's the nature of the middle ear? So it's a cavity, it's a structure. It's like a cavity, as you see here. It's like a room lined by mucous membrane and usually filled with air. So it's air-filled cavity located in the vitreous part of temporal bone. You have to see on your atlas the vitreous part of temporal bone, right? So what's in there? Yes, there are a couple of structures. Mainly you have the Auditoryossicles, the smallest bones in your body. 1, 2, 3, malleus, incus, medius, incus, and stapes, that they transmit, of course, the vibration from the tympanic membrane or the eardrum into the inner ear, because you know here is the inner ear. So the vibrations come, vibrates the tympanic membrane, transmitted through these bones to the inner ear, the site for, of course, hearing. Okay. Yes, in the tympanic cavity or in the middle ear, what you see here communicates, as I mentioned, anteriorly and posteriorly. So anteriorly, this cavity, the middle ear, communicates with the nasopharynx, as you see here, and that this is the anterior opening, right, through, of course, the pharyngotympanic tube, or as I mentioned, auditory tube. Now, posteriorly, it communicates with the mastoid antrum, with the mastoid air cells from here, right? So there's an opening and there is a mastoid air cells here in the mastoid process. So it communicates with it. So it has anterior door and posterior door. Yes, as I mentioned that the middle ear is like a room. And the room has, of course, a roof and floor. And of course, other than the roof and floor, you have 4 walls, anterior and posterior, medial and lateral. Where is the lateral? The lateral should close this, but already I remove it. Already, of course, the author removed it, the author of this of the textbook. Anyway, so the lateral wall should be here, the tympanic membrane, the eardrum, but it's removed to get the look to inside. To understand this figure, I would show you this again. You are removing the eardrum, right? And you have a look here into the middle ear. So this is the middle ear, which is like a box, right? It's like a room, right? So now this is the lateral wall of this room. We removed it, the eardrum. And this is, if this is the lateral room, of course, this is the medial one, this one, that's in your face. While this is the roof and this is the floor. This is the roof and this is the floor. This is the roof and this is the floor. Okay, and you have the anterior, anterior wall. You have the anterior wall and you have the posterior wall. This is the anterior wall and this is the posterior wall. Now, and of course in the middle ear there is ossicles, bones, 3 bones. They are here but also removed. So there are no bones here already removed. To understand what's going on, we will talk about them. Now let us start with the roof and floor of the middle ear. Okay, here is the auricle, external acoustic meatus, eardrum. Yes, and this is the middle ear. So the floor of the middle ear of this cavity formed by this plate, in which this thin plate separates the middle ear from the internal jugular vein, right? Internal jugular vein. And if there is infection sometime in the middle ear, it can cause internal jugular vein thrombosis, right? Because it's just separated by a thin plate of bone. This is the floor of the middle ear, right? But what about the roof? This is the roof. This is the roof of the middle ear, formed also by a thin plate of bone, similar to the floor, but it separates the middle ear not from internal jugular. No, it separates the middle ear from the temporal lobe of the brain. Here is temporal, located the temporal lobe of your brain, right? So that's interesting. So we finished the roof and floor. Look at the floor, the internal jugular vein related to it. That's, you see here. Okay. Now let us start with walls. So the anterior wall, but before the anterior wall, can you understand which kind of view you are looking to? This is, again, this is the eardrum, right? This is the mastoid process behind your ear. This is the auricle should be in the screen. Now you are watching the video. On the other side of the screen, inside the screen, there is an auricle here, right? There is an auricle here on the other side of the screen. And that's laterally, right? So this is medially. You are looking medially. That means you are looking from here. But the internal ear and these structures removed, right? So you're looking from here, so you can see the internal surface of eardrum, right? So it's like moving this. It's like moving it like this, right? So erase these things. So again, you are looking from the you remove the internal ear and you are looking to the from medially, I mean. So this is again the middle ear. So we finished the floor and of course the roof, and of course now we'll start with the anterior wall. That's here, anterior. You remember that the pharyngeal-tympanic tube, or we call the auditory tube, is located anteriorly. That's fine. Leave it for now. There is another opening also for a muscle, but the anterior wall, let us start from here. The anterior wall formed below by a thin bony plate that you see here. Okay, so the anterior wall also formed by a thin plate of bone that separates the middle ear from what? From internal carotid artery. So we mentioned that the roof separated from temporal lobe of brain, while the floor separates the middle ear from internal jugular vein, while the anterior wall separated the middle ear from internal carotid artery. Also, in the anterior wall, you have an opening, as I mentioned, for tympanic tube, and another opening above it for a muscle called tensor tympani muscle. From its name, we will talk about it, but from its name, it's for tension. It will tense the tympanic membrane, the eardrum. So it inserted in the handle of malleus that attached to the eardrum or tympanic membrane, I mean. Here is the muscle, right? Okay. Now we finished the anterior wall. That, of course, this is the middle ear that's separated from anteriorly by a thin plate of bone separated from the internal carotid artery, and you got two openings, one for the largest one for pharyngotympanic tube and other one for a muscle called tensor tympani muscle. Okay, we finished that. Now let us move on the opposite side to the posterior wall. The posterior wall is very simple. It has an opening here called adytus to mastoid antrum. What does it mean? It's an opening for the mastoid process. Here is the mastoid process you see here in this figure. So there's an opening to the mastoid process. It's called adytus to mastoid antrum, right? Ultimately to the mastoid air cells. And you have a small pyramid that's a pony projection, like a pyramid. We call it a pyramid for the attachment of the smallest muscle in your body. It's called stapedius. It's called stapedius. Let us look here. So this is the cavity of the middle ear, and posteriorly, in the posterior wall of it, because you know this is the anterior wall that contains the pharyngotympanic tube, but posteriorly you have the adytus to mastoid antrum, right? In which is the mastoid process and mastoid air cells, right? And you have this projection, which is the pyramid for the attachment of a small, very small muscle, the smallest muscle in your body, which is the stapedius muscle. So again, we finished. I like to repeat: floor, roof, right? And we finished the anterior. We finished the anterior wall, and the posterior wall are against each other, right? And still, what we have? Still, we have the lateral wall of middle ear, and if this is the lateral, that means this is the medial wall. By this way, we got this room, middle ear. Let us start with the lateral wall. The lateral wall is the easier one and the most interesting one. Why? Because it's composed largely by the tympanic membrane. Tympanic membrane, it is the eardrum, طبلة الأذن. It's largely, yes, as I mentioned. Now, interestingly, the eardrum or the tympanic membrane, it's not directed laterally like that, 90-degree upside down. No, it's a little bit facing downward and forward and laterally. Yes, it's faced laterally, it's very clear, but it's like facing a little bit the ground. If you see, it's not like that, right? Or it's not, sorry, it's not like that. No, it's directed downward, forward, and a little bit, and laterally, of course. Now, interestingly, the eardrum is extremely sensitive to pain because it's innervated from inside and from outside. And the innervation of eardrum is very important. This is number one. Now, how can I remember the innervation of eardrum? Very simple. You remember the external acoustic meatus that's innervated by auriculotemporal nerve and vagus nerve, and minor participation from facial nerve. So the same, the lateral surface of the outer surface of tympanic membrane innervates or innervated by the same nerves, auriculotemporal and vagus, right? While the inner surface innervated by cranial nerve number 9, which is the glossopharyngeal nerve. Glossopharyngeal nerve. There's a branch called tympanic branch for the tympanic membrane, of course, right? So it's important. Now, what's also the tympanic membrane is a very important structure, right? So I like it. And interestingly, as I mentioned, I didn't mention that, and now I will say that the tympanic membrane it's concave laterally. That means when you look at it from lateral side, that means, let us get back. If you have a look from here, it's concaved, right? It's concaved membrane or structure, right? In which this concavity made by, let me show you here. Yes, it's concave. Look at the malleus. The malleus, المطرقة, has a handle, this handle. The handle of the malleus attached to the inner surface of tympanic membrane, and it pulls it inward, right? So by this way, the tympanic membrane, I don't know if it's clear for you, it's like concave like that because of the handle of the malleus here. And the most depressive point, it's like depressed, right? There is a concavity. The deepest concavity, the deepest point of concavity is here at the tip of the malleus. We call it ample. We call it ample. So this is, you look into the lateral surface using otoscope into the patient's ear, and you got this preview in which you see the shadow of the handle of malleus, and the tip of this handle is the most depressive concave point, right? In which it's called ample. This is number one. Number two, you're looking again into the ear, into the ear of the patient, and you use the otoscope and light. So you will find also in that view this triangular cone of light, which is at 5 o'clock, right? At the position of 5 o'clock, we call it the cone of light. Again, this is real view in which this is the shadow of the malleus, and this is the top of the handle of the malleus, in which this is the most deepest part. We call it the ample, and you see here is the cone of light, which is at the 5 o'clock location. Now, because of the it's of course surrounded by fibrocartilage membrane, and because of the handle of the malleus here that tightens the tympanic membrane. So most of the tympanic membrane is tight. So this part we call it pars tensa. Pars tensa. While this small flaccid part we call it pars flaccida, right? So this is the pars flaccida, and this is the half is pars tensa. So we are describing, the tympanic membrane. Okay, now Lastly, the medial wall. Lastly, the medial wall of the middle ear. Again, this is, let me remind you, the middle ear with the roof, floor, anterior and posterior, and the lateral wall. Still, we have this medial wall. Now, look at the medial wall. Look at this bony structure here. There is a bulge here. You see this bulge? This bulge creates by the basal turn of the cochlea. This is the cochlea, which is like snail, right? So the first or basal turn, it creates this structure, which is called promontory. Above the promontory, there is opening, oval opening, and below it there is a round opening or round window. Oval window, a round window. Also, let me pay your attention to the nerves there from internal acoustic opening or meatus. You have facial nerve and vestibulocochlear nerve. Look at the facial nerve that penetrates, of course, the vitreotemporal bone and passes to the middle ear. This is the middle ear, right? So it passes to the middle ear and it creates a kind of a prominence here. Let me erase this. You see this prominence here in the middle ear. This is the middle ear, right? This is the middle ear. There's a prominence here, which is the prominence for facial nerve, and there is above it, there is a prominence for lateral semicircular canal. We'll talk about it in the middle, in the inner ear. Back to the wall. So this is again the last wall, which is the medial wall, and I think I showed you this bulge, which is the promontory, which is created by the basal turn or the initial part of the cochlea. And of course, there is a nerve plexus on it called tympanic nerve plexus. But as I mentioned, above this promontory, there is an oval window, and below it, there is a round window, right? So what else? Yes, we remember the facial nerve that comes and penetrates passes through the upper part of the middle ear, and the middle ear, and creates like a prominence, covered of course, but it creates a prominence, and above it there is another prominence for the lateral semicircular canal. We'll talk about it. Okay. Remember the upper one, which is the oval window, and the lower one is the round window. We call it also the oval window, we call it finstra vestibuli, and the lower one, the round one, called finstra cochlea. Before jumping to the talking about the ossicles, I would like to talk to you about the very important tube, which is that known as pharyngotympanic tube that exists in the anterior wall of the middle ear, and also it's known as Eustachian tube. So this is the Eustachian tube, or we call it pharyngotympanic tube, or we call it auditory tube. Anyway, the Eustachian tube extends from, as you see here, from the middle ear, or here, let us say, from the middle ear to the nasopharynx, which is very important. And that means it permits the air to get in and also leave the middle ear cavity. So it's a connection between nasopharynx and the middle ear. So what's the significance of this, let us say, tube? Indeed, let me take this one. You know that the pressure outside on each, we need the pressure of the air on each side of the eardrum of the tympanic membrane to be equalized in order for tympanic membrane to work properly. And so you have the air pressure from here laterally, And in order to make it like equal on both sides of the tympanic membrane, we need air pressure to get in from the inside from here, and this achieved through this very important tube, Eustachian tube, in which it connected to the nasopharynx, and the air comes from there and get in from the tube to the internal surface of the ear drum or tympanic membrane. So what you need to know about this the tube, that's about, in adults it's about 40 millimeter in length, and the Eustachian tube directed, as you see here in adult, for example, downward, forward, and medially, although in infants it's a little bit horizontal. What's the significance of that? It makes it's not just horizontal, but also it's short, that permits the spread of bacteria and infection from the nasopharynx to the middle ear, and most of the time, especially in infants and children, it causes it's the source for the infection that ultimately lead to otitis media, or the inflammation of the middle ear. Now, if you look to the canal, and I would remind you with the external acoustic meatus, you remember the outer third was cartilaginous, while the internal two-thirds is a pony. Now, this pony continues with the pharyngotympanic tube, in which the posterior one-third is a pony, which is a continuation for the external acoustic meatus. Let us say that, and which is the easier way to remember it, while the anterior two-thirds, as you see here, is cartilaginous, and the border between the pony part and cartilaginous part known as isthmus, which is the narrowest part. Yes, we explained that the auditory tube or Eustachian tube is the source of infection from nasopharynx to the middle ear and causing otitis media. So as you see from the previous slides, that the middle ear contains three bones, three small bones. We call them Auditoryossicles, the smallest bones in our body. So they are together. If you extend them about 1 inch, that means 2.5 centimeters, they are the malleus, incus, and stapes, right? The malleus attached, as you see here, by its handle to the eardrum, right? And it also articulates with the incus, and incus articulates with stapes, and stapes it's a kind of footplate by its base, closed or fitted to oval window, if you remember, right? So it closes the oval window. So now, what's the function of these kinds of auditory ossicles? Indeed, what they do is they amplify the sound vibrations and waves. When they come and vibrate the eardrum, they also amplify the sound vibration until it reaches the oval window. So the malleus vibrates in the incus, the incus vibrates the stapes, and then the stapes transmits the vibrations into the fluid of the inner ear at the oval window. So you can see follow these steps all the way until you reach the oval window. Then they vibrate the fluid inside the scala vestibuli. We will talk about it. Now, here is another slide shows the different structures of each ossicle. So the malleus, which is known as that means hammer, مطرقة يعني. So it has a head, neck, and lateral process and handle. On the other hand, you know that the head of the malleus articulates with the incus by its body, and of course the incus has body, short process and long process. Then the incus at the end with the lenticular process articulates with the head of stapes. The stapes, which is like the footplate for the horse's saddle, like that for the horse's saddle, in which that you put your foot there to jump up over the back of the horse. So it has a head, neck, and anterior limb and posterior limb, and most importantly, it has a base footplate that fits and encloses the oval window as you see here in this figure. So why I'm talking about different structures in the ossicles? Yes, we don't care too much about all of these structures, but there are a couple of important structures. Now, let us define the muscles and where they attach to which structures. I would like to remind you for the most important things here. In the malleus, you have the handle that articulates to the tympanic membrane, and of course, there is a muscle, we'll talk about it, also attached to it to tense it to, at the end, ultimately tense the tympanic membrane. And also, you have the stapes that has head and neck, so take care for the neck that there is a small muscle, stapedius, attached to. This is what I want. So I will start with the first muscle, which is the tensor tympani muscle. If you remember, we said that this is the anterior wall of the middle ear. So you are looking to the, let me let you understand what you see. You are looking to the middle ear from inside. That means you remove the inner ear from here, and now you are looking to the middle ear, right? So this is the anterior wall of the middle ear that contains, of course, a thin plate here separated from internal cartilage artery and the pharyngotympanic tube. Yes, pharyngotympanic tube that has medial, or let us say posterior bony part and anterior cartilaginous part. So most importantly, you have another opening other than this opening. You have an opening for a muscle, a small muscle called tensor tympani muscle, because it tenses the tympanic membrane. This is the tympanic membrane. How it tenses the tympanic membrane? It first of all, it originates from the bony part and from cartilaginous part of pharyngotympanic tube, Eustachian tube, I mean, and it inserted by its tendon to the handle of malleus, as you see here. Here is the attachment, and you know the handle of malleus attached to the medial side of the or to the internal side or medial side of the tympanic membrane. By this way, when tensed, it indeed limits the vibration. For example, there is a vibration or sound waves, loud sound and so forth, so the tympanic membrane will vibrate strongly, but using this muscle, when it's contracted in that response, it decreases and limits the vibration, right? And because it attached to the handle of malleus, and handle of malleus attached to the tympanic membrane. So this muscle is important, but what also important is to know that innervated by V3, mandibular nerve of trigeminal, mandibular branch of trigeminal nerve, right? That means V3, cranial nerve number 5, which branch? V3. Now, there is another muscle you have just two muscles in the middle ear, right? You have two muscles. This one anterior in the anterior wall, and there is one opposite it into the posterior wall. This one. You remember the pyramid, from pyramid there is a stapedius muscle, the smallest muscle in your body. So here is the stapedius. From its name, stapedius from stapes. That means it fixes and pulls the stapes to the back. It attached to the neck of stapes, right? So when it's contracted, it prevents the excessive oscillation, right? And dampen that vibration. So dampen, I mean the stapes, and of course, ultimately the vibration. So the smallest muscle in your body, but it's innervated by facial nerve. By facial nerve, which is not shown here. You can see a branch of it, but you cannot see it. So I will show you in after a couple of slides, right? So it's innervated by facial nerve, a nerve called nerve to stapedius muscle. We covered the middle ear by its floor, roof and floor, anterior wall, posterior wall, medial wall, and lateral wall. And also we mentioned the ossicles. We talked about the ossicles bones there and the two muscles there. Now it's the time to talk lastly about the nerves in the middle ear. And as you see, if you remember, this is the promontory that's created by the basal part of the cochlea. Now you can see a kind of a nerve plexus called tympanic plexus. Tympanic plexus comes from or formed from the tympanic nerve, which is a branch of glossopharyngeal nerve, a cranial nerve number 9, the same nerve that innervates the medial side of the tympanic membrane. The medial side of tympanic membrane. Now, the tympanic nerve, as you see, of course, gets a branch from the internal carotid plexus, as you see, and they form the tympanic plexus. This plexus, of course, supplies the mucosa of the middle ear. Also, it supplies the mastoid cells and the auditory tube, and also not just that, but also it gives a branch. This branch is the lesser petrosal nerve. The lesser petrosal nerve. You remember that the middle ear is located in the petrous part of temporal bone, which is easier to remember. So this branch from tympanic plexus called lesser petrosal nerve that leaves the petrous part of temporal bone and passes on the upper part of the petrous bone until it reaches the foramen ovale. Then it leaves the middle cranial fossa through this foramen. Then once it reaches the otic ganglion, the parasympathetic ganglion, it gives its synapses there, and from there fibers moved to the parotid gland. So this secretomotor supply to the parotid gland for secretion. This is the story of lesser petrosal nerve. I think from the figure here also you can see the tympanic branch of glossopharyngeal nerve with a branch from the plexus of internal carotid artery to form tympanic plexus, and there is a lesser petrosal nerve leaves the middle cranial cavity through the anterior wall. We have the facial nerve. Look at the petrous part of temporal bone that contains the internal acoustic meatus, that through which the facial nerve, cranial nerve number 7, and vestibulocochlear nerve also pass from there. Now, I would focus on the facial nerve because it passes through the middle middle ear, as you see, before it exits from there. So the facial nerve passes through the internal acoustic meatus, then passes through this canal that called the facial canal. Then there it creates a kind of a ganglion called geniculate ganglion. Now, from the geniculate ganglion, the first very airy first nerve of facial nerve arises from there. So this is the first branch of facial nerve called a greater petrosal nerve, not the lesser petrosal nerve. It's the greater petrosal nerve. We mentioned that the lesser connected to the parotid, right? But the greater petrosal nerve also it leaves the petrous part of temporal bone and passes on the surface of petrous pus in a groove until it reaches the foramen lacerum covered by cartilage. But in its way, there is an internal carotid artery, so it passes below the internal carotid artery, and it took a kind of a branch from the petrosal nerve there, called deep petrosal nerve, to form nerve to pterygoid canal. Anyway, the greater, once it leaves through the foramen lacerum, the greater petrosal nerve, of course, will join the pterygopalatine ganglion, right? That, of course, then postsynaptic fibers or the parasympathetic postsynaptic fibers will give supply to all glands above the oral fissure. For example, if this is the mouth, so above the oral fissure, glands like lacrimal gland, glands in the nasal cavity. What I want to say that all salivary glands above the level of oral fissure, like here in the nose, in the palate, in the and also the lacrimal glands in the orbit, those innervated by greater petrosal nerve, right? Which is a branch of facial nerve. Now, other than the greater petrosal nerve, then the facial nerve continues like in the just posterior to the stapes. You see, creates a kind of a bulge here, right? Creates like a bulge in the middle ear. Then it passes behind the pyramid. Do you remember this bone, which is the pyramid? This pyramid forms part of the posterior wall of the middle ear, then passes behind it. Once it passes behind it, you remember the pyramid gives, it's the site for attachment of the stapedius muscle. This is the smallest muscle in your body that attached to the head of stape, to the neck of stapes. So this is the stapedius muscle attached to the neck of stapes, innervated by a nerve called nerve to stapedius, which is a branch, the second branch of facial nerve. Now the facial nerve continues down until it leaves through this foramen, which is called stylomastoid foramen. This is the mastoid process, right? This is a mastoid process. So this is stylomastoid foramen. But before it leaves in the mastoid part here, it gives a nerve, the third one, which is the chorda tympani. The chorda tympani nerve, let me show you in this here. So as I mentioned before, the greater petrosal nerve, this one, gives parasympathetic supply to lacrimal glands, nasal area, and palatine glands there. That means any salivary gland above and lacrimal gland above the oral fissure, above the palate and nose and so forth, above the oral fissure, right? Like nose, like the palate, like the orbit and so forth. But the chorda tympani, which is arises here, as you see, and let us look here. This is another view. right? Internal view. It passes up behind the incus and malleus. You see, between the incus and malleus. So that's why always prefer to make a rupture if there is a need to rupture the tympanic membrane. It prefers to be in the inferior posterior area. Why? Because it's away from chorda tympani. Chorda tympani passes there, then it leaves the midlicranial fossa through the pterygotympanic fissure. Then once it leaves, it joins the lingual nerve. Lingual nerve is a branch of mandibular branch of V3 of trigeminal nerve. Anyway, I will show you now a figure after a while. But now the chorda tympani, I would use different color. The chorda tympani, it's responsible for all glands below. This is the oral fissure. This is for example, okay. Is the mouth. So below the oral fissure, all glands below the oral fissure, including those small glands in the floor of oral cavity and submandibular gland and sublingual salivary gland, all these glands, the parasympathetic fiber or the innervation for them comes from the chorda tympani, right? So above the oral fissure is greater petrosal nerve. Below the oral fissure, all the glands, salivary glands, and so forth, are by the chorda tympani. So this is the chorda tympani, right? Yes, once it leaves the chorda tympani, as you see here, through the petrotympanic fissure, this is the petrotympanic, because this is tympanic plate and this is the petrospartum, so the petrotympanic plate, then it passes there laterally and joins the lingual nerve, which is a branch from V3, which is the mandibular branch of trigeminal nerve. Then it gives like fiber. That means the chorda tympani sends parasympathetic fiber through the lingual nerve. That means it uses, the chorda tympani uses the lingual nerve as a way to reach the sublingual and the different glands, including the sublingual and submandibular gland, to innervate both of them, right? What else? It also carries sensation from the taste sensation from the anterior 2/3 of the tongue, because we know that the lingual nerve reaches the anterior 2/3 of the tongue, and the taste sensation carried through the lingual nerve, but ultimately to the chorda tympani nerve. We finished the external ear and the middle ear, and it's the time to move to the internal ear. It's not that much details in the internal ear, most of it's like physiology, but I would like to say that again, not just the middle ear, but also the inner ear, for what we call it labyrinth, is also located in the petrous part of the temporal bone. So labyrinth, or the inner ear, composed from bony labyrinth and membranous labyrinth. That means simply it's like a skeleton. That the first, there is a bony part that you see here, which is like a bony structure. We call it bony labyrinth, and inside it there is a kind of a membranous structures, membranous duct, and so forth. So this is the membranous structure inside it that I'm drawing, right? So just move this and put it there inside this bony skeleton. Anyway, the bony labyrinth, which is, as you see, a series of bony chambers lined by periosteum, and indeed it contains a fluid inside it. That means there is a kind of, I would say, a fluid here filled this bony cavity, and there is a duct or membranous structures there, and inside the membranous structure there is also a fluid here. But look at the membranous structures that flow or swim like inside a bony cavity filled with fluid. I will explain more in the after a couple of slides, but this I would say the clear fluid here inside the bony labyrinth is called the perilymph, right? Perilymph, which is suspended the membranous labyrinth there, because we mentioned that there is a kind of a ducts and the system there called membranous labyrinth. This is the membranous labyrinth that you see here. Let me show you in another figure. You see this blue color. This is a membranous labyrinth located inside the bone, inside the bony labyrinth, right? So inside this membranous labyrinth there is an endolymph. Here is inside these ducts, endolymph. But as I mentioned, here in the bony labyrinth there is also a fluid surrounded and suspended these membranous parts. This is called perilymph. That's I'm drawing. This is the perilymph located here and everywhere, but not inside the membranous. The fluid inside the membranous labyrinth here in these ducts, it's called endolymph. That means you have endolymph and you have perilymph. Here is located outside. It's surrounding it inside the bone, right? Surrounds and suspends the membranous labyrinth. So as I mentioned, the membranous labyrinth is a series of membranous sacs and ducts located within the bony is located here. I mean, let me draw it. Located here inside the bony labyrinth, and as I mentioned, here inside it there is a lymph, a clear fluid called endolymph. So back again to the bony labyrinth. So it consists from the vestibule in the middle, this bulge, and semicircular canal, as you see here. You have 3, and you have the cochlea, which is like a snail, right? Now let us start with the cochlea. When you talk about the cochlea, which looks like the snail, and at the end of the day it converts the vibration coming to the eardrum and transmitted through the ossicles. It converts the mechanical energy into electrical energy and signals carried by the nerve, vestibulocochlear nerve, to the brain, right? So, and you know, as we mentioned, that the first term, this one of the first part of the cochlea here, it creates a kind of promontory. This part, this bulge called the promontory, we talked about it, right, on the medial wall of tympanic cavity, right? Tympanic cavity, I mean what? The middle ear. We call it tympanic cavity, right? So the cochlea contains a duct called cochlear duct. This is the duct inside the bone. This is part of membranous labyrinth. So this membranous labyrinth, the membranous part, which is called, because into the cochlea, it's called the cochlear duct, right? Which is, as I mentioned, part of from membranous labyrinth, right? Now, if you take a cross section through the cochlea, let us say cut here, right? And have a look to this cut, right? If you take this segment, for example, you cut it from here and you look at it, you will find it like divided into three parts, 1, 2, and 3. So these canals that divided in this, look at this cross section. So you have 3 channels there. The most important one here is the cochlear duct. We call it scala media. Scala media because it's in the middle between the scala vestibuli and scala tympani. So you have, that means the 3 channels: scala vestibuli, scala media, and scala tympani. So the cochlear duct, this duct or scala media contains very important structure, which is the organ of Corti. This is very important. So the organ of Corti located in the cochlear duct, right? In the cochlear duct. Now, scala vestibuli, it ends, as you see, look at the cochlea, for example, one turn of cochlea, the first or basal one. So you remember the stapes that close the oval window here. So the vibration comes from here, hits the eardrum, vibration transmitted through the ossicles until it reaches the stapes. The stapes hits the oval window and moves the, what's the name of fluid here? This fluid is the perilymph, but the fluid inside the duct is the endolymph. Anyway, the scala vestibuli, the channel that located here in the cochlea, it ends at the oval window. This is the oval window that is closed by stapes, right? So this is scala vestibuli. Then at the end, then there is a turn. The vibration move there and move the perilymph and so forth. Then at the point called helicotrema, then the waves continues and the vibration of perilymph continues in another channel. Now it moves from scala vestibuli into scala tympani, right? At this point, this is now the scala tympani here, and it ends in the other opening, which is the round window. Let me remind you that we mentioned, let me show you here. So this is the promontory that's created by the basal part of the cochlea. Above it there is oval window, below it there is a round window. So the oval window closed by stapes, the round window closed by secondary tympanic membrane. Anyway, when you take a cross section through the cochlea here, you will find it there is three channels. These channels divided, of course, by this part by the cochlear duct, right? Because you know inside it there is, let me erase it. Inside the cochlea there is cochlear duct. You see this cochlear duct? So this cochlear duct divides, like, say, let us take cross section here. It was like that. Then there's cochlear duct here. You see? Then it divides it. This is cochlear duct, right? By this way, it divides the cochlea into 3 channels. This is 1, 2, 3. But this is the cochlear duct that you see here. Now, this is the cochlear duct or scala media that contains the organ of Corti or spiral organ. You call it organ of Corti or spiral organ. This is the microphone. This is the microphone of your body. This is very important. We'll talk about it. Anyway, but you see from the what I explained before, how the sound or vibration comes to the oval window, then to scala vestibuli, then turn at this point, which we called helicotrema, into helicotrema, then shifted to the other channel, because you know the cochlea is like that, right? So once it moves like because I will show you because I'm trying to show you that how it's moved now. Let's start now the other side. The fluid now moved to go back to the other side. I'm trying to see wait, let us see if it works here. So say there is a vibration coming from here, and it goes here through the scala vestibuli, scala vestibuli. Then at this point, now it has to return back. This is helicotrema, the point of meeting of scala vestibuli with scala tympani. Now back again, the vibration moved in the scala tympani, and ends here in the round window. So it gets in there through the oval window, as you see, then all the way until to reach the end of the cochlea. Once it reaches the end of the cochlea, it now at the helicotrema, the point of meeting of both here, then the vibration continues in the other channel, which is the scala tympani, all the way until it gets out through the round window here, dampen here. This is the idea. Now I would like to foster again on one idea again and again, that the the cochlea was like this, then this is the bony labyrinth. Inside the bony labyrinth there is a membranous labyrinth, which is like that, say, right? So this one, the membranous that you see here in this color, the blue color, right? So this is the blue color, the membranous, right? But I'm talking about the cochlea, so this is the cochlear duct. So this is the cochlear duct. This is the cochlear duct. And the cochlear duct, because it exists, so it separates by its existence, it separates, or it creates, or it converted the cochlea into 3 channels, 1, 2, and itself the 3. Cochlear duct, scala vestibuli, scala tympani. The sounds come through the scala vestibuli, then moves all until it reaches the end, then move to the scala tympani, then back again to foramen, round window. Okay, so here inside the the idea that inside the cochlear duct, what you see here is endolymph, the fluid there called endolymph. But in this area, it's called perilymph. That means the lymph that surrounded the cochlear duct is called perilymph. It doesn't matter in the, it exists in scala and scala vestibuli and scala tympani. Sorry for that. Now, in the cochlear duct, this duct, inside it there is a fluid called endolymph. Here there is inside there is endolymph. But you know that this duct divided the cochlea into three parts, right? As I mentioned, one, two, 3. Now, inside the cochlear duct, there is endolymph. Here, inside there is endolymph, inside this duct. And surround this duct, this area, the space that's here on both sides here, that means here and here, is perilymph. So, as I mentioned, that the sound, the vibration, of course, moving by the stapes and oval window here, moving the perilymph. Perilymph. We'll talk about more. This is, I can explain what I'm saying. This is the cochlear duct here. Inside the cochlear duct here is the endolymph and surrounded by perilymph. I think that's more than enough. Yes, we said that vibration of stapes on the window send vibration into fluid. Yes, we said that. Okay. Now this is again, repeat the process. The external auditory canal, there is a vibration, sound waves that hits the tympanic membrane or the eardrum, then transmitted through the ossicles. Once they reach the, of course, from malleus, incus, and the stapes. Now the stapes pushed on a fluid of scala vestibuli, right here at the oval window. This is the oval window. So in the scala vestibuli, the perilymph moved and pushed there until it passes in the scala vestibuli until it reaches the last point, which is here. This point here, the meeting point. Let me show you. Here is the meeting point, helicotrema. Once it reaches the helicotrema, it now continues into the other channel, which is the scala tympani, right? All the way until it reaches the and dampen or dissipated at the round window that's covered by secondary tympanic membrane. Now, what will happen when the perilymph vibrated and moved in this way? What will happen is that they move the central duct. They move this duct, the cochlear duct. That means when the fluid moved here from oval window here in the perilymph and moving all the way then back around, so the target, when they move, the target is this duct, the cochlear duct, this duct in the center. So the cochlear duct or scala media is the target. They vibrated it. They vibrate the sensors there. We said that in the cochlear duct there is a very important organ called organ of Corti, which is the microphone, that sense all vibrations and sounds. This is the organ of Corti. So when the perilymph moved here and back here, so in this circle it moved this vestibular membrane. Vestibular membrane moves the endolymph here. Let me explain to you. So the perilymph that's here, once moved, it vibrates the vestibular membrane. The vestibular membrane, when it's moved, it moves the endolymph here. The endolymph, when it moves here, it moves the basal membrane. The basal membrane, when it's moved, it's moving the hair cells here, which is part of organ of Corti. The hair cells covered by tectorial membrane. Tectorial membrane, once it moves, that means you have like hair receptors covered superiorly by tectorial membrane. When they moved, because of the process I said, the tectorial membrane sense this movement and it's connected to the nerve that you see here. Then the signals transmitted to there. Okay. Okay. Now what else? Now, as I mentioned, the pressure waves travel from scala vestibuli to the vestibular membrane here. Now, then to the endolymph here of a cochlear duct that exists in the cochlear duct that was drawn in the blue color, of course, but here is red color. I don't care. Then the basilar membrane, as I mentioned, the endolymph affects the basilar membrane. Then the basilar membrane, once vibrates, it moves the hair cell that you see here. The hair cells of course, the hair cells of spiral organ, right? Spiral organ is important. This is structure called spiral organ. This is very important, right? Or organ of Corti, right? So covered again these hair cells by tectorial membrane that you see here. That's of course generate nerve impulses in the cochlear nerve. So the organ of Corti, which is very important, is a sensitive element, as I mentioned, in the inner ear, and it's a microphone of your body. Because you saw how it's important. It's found in the cochlear. It's found in the cochlear duct, or you can say scala media side, of course, of the basilar membrane, on the basilar membrane, right? On the what else? There are two types of receptor cells, because we said we have hair cells. You have the inner hair cells and you have the outer hair cells, and of course it contains 4 rows of hair cells which protruded from its surface, but I'm curious about the inner and outer in anatomy. It is mostly physiology, but anyway. So above there is a tectorial membrane which moves in response to the movement of the hair, and endolymph that moves these hair cells to the pressure, of course, in response to pressure variation. And you see here, it is better the hair cells here above the tectorial membrane that senses this movement and connected to cochlear nerve. Now, the vestibule. Vestibule is the, as I mentioned, the central part of the puny labyrinth, and inside, when you say vestibule, you're talking about the puny part. Inside the vestibule, there is a membranous labyrinth. But which kind of membranous labyrinth? In cochlea, we said that is, we have cochlear duct. This one, the blue one. Yes, we finish it. Now, let us jump to the vestibule. Inside the vestibule, there is membranous part. Yes, there's membranous part, which is the saccule and utricle. Saccule and utricle, they are part of membranous labyrinth. You see these sacs filled with endolymph, right? So the lateral wall of vestibule, as you see, because you know this is the inner ear and this is the medial and this is lateral. So in the lateral wall of vestibule, there are an opening, which is the first one, which is the oval window, which is closed by the base of stapes, right? And you have, of course, an foramen round window. So you have oval window and you have below a round window which is closed by the canal tympanic membrane, and we explained that already. Now let us jump to the semicircular canal, because we mentioned earlier that the bony labyrinth has cochlea. We mentioned there's cochlear duct inside it. When you come to the vestibule, you have the vestibule. Here is the bony part. Inside it there is a saccule and utricle, and you have a semicircular canal used for bone. That means this is a bony canal, right? This is the semicircular canal, but the membranous part, the ducts inside it, called semimembranous duct, right? Semicircular duct. So this is a semicircular canal, and inside it there's semicircular ducts, right? Back again, here. So the semicircular canal is the bony part. This is the bone. You see the bone? There is a canal there, like a skeleton there. Inside it, there is a semicircular duct. That's why there's say canal and duct. So you have three. You have three semicircular canal and of course ducts. You have the anterior one, which is sometimes called superior, and you have the posterior one, and you have the lateral semicircular canal, and inside them there are ducts, semicircular duct, the same name, anterior, posterior, and lateral. Each canal, you see, has a swelling one end of it that's called ampulla, right? And here's one. So for example, the anterior semicircular canal has just one. The posterior semicircular canal has just one. The lateral semicircular canal has one ampulla, right? And the canals, as you see here, open into the vestibule by 5 orifices. If you calculated them, you will see how many orifices we have. We have 1, we have 2, we have 3, we have 4, and we have 5. Why? Because the anterior and the posterior semicircular canal share one opening, right? Common one, right? So no, forget that. So again, to the membranous labyrinth that contains, as I mentioned, 4 ducts and 2 sacs. You have the cochlea that starts from here. Again, this is the cochlear duct, and you have the sacs. Of course, you have the saccule, and you have the utricle, and of course, you have the semicircular ducts. These blue, of course, I'm indicating to the blue colors. And again, you know that cochlear duct inside lie within the cochlea, and it divides as I mentioned earlier, the cochlea into, or the bony cavity there in the cochlea, into scala vestibuli and scala tympani. And you have the sacs, utricle, and saccule. They are located in the utricle and saccule in the vestibule. This is the vestibule bony part, so they are located here. And you have also the what we call it, the semicircular ducts. These blue colors, the ducts inside the bone, inside the semicircular canal. This is the idea that I want you to understand. So you have to know each one and where it's located. So yes, this is what I also explained, that there is a perilymph, which is within the scala vestibuli. separated from the middle ear, of course, by the base of stapes. It closed the oval window here, and once the vibration reached, it hits the stapes hits the oval window, then the perilymph. It continues as I mentioned earlier. Let us follow it. The perilymph now vibrates all the way until it reaches the helicotrema. Now from helicotrema, it meets the scala tympani, right back again into the cochlea. Let us back again. Where is that? Okay. Of course, I'm in a scala tympani, right? Scala tympani until the vibrations end now in this round window. It's closed, of course, by secondary tympanic membrane. So lastly, I think this is, I don't know, last one. Yes, almost the last one. So what I want to say that the utricle and saccule, they are really have a sense organ called the macula of the utricle. So the utricle that you see, let me remind you, this is the utricle that's close to the semicircular canal. It's responsible for linear acceleration in the horizontal plane. What does it mean? Because it's the sensation, the hair is like that, oriented like that. So when you move in horizontal plane, like for example, when you sit like driving in a car, and suddenly you find something strange in front of yourself, and you hit the brake, then your head will move like this and like that in the horizontal plane. So this acceleration movement sensed by the utricle, while the saccule, because the hair receptors oriented like this, so it's responsible to respond to the linear acceleration in the vertical plane, like what? When you are in elevator, so these hair cells, when the elevator suddenly stopped, so you feel that because of the hair cells oriented like that in the saccule. So the movement, you sense the movement in the vertical plane, while the semicircular ducts that you see here is responsible for rotational movement in any direction, like moving your head right and left and make a rotation, right? So all of them at the end of the day will be responsible for orienting your head either in the horizontal plane or vertical plane, or rotational condition, rotational movement, and in equilibrium, right? So just remind you that yes, these structures, utricles and saccule and semicircular canal, they are responsible for equilibrium at the end of the day, but the organ of Corti or spinal organ in the cochlea responsible for hearing. That means the inner ear responsible for hearing by the cochlea, and equilibrium by the utricle, saccule and semicircular canal. So as I mentioned, in the cochlea you have a spiral organ or organ of Corti that contains this receptor for hearing. This is tympanic membrane perforation, in which what I want to say, you can read it of course, but here is the most important thing here, because the chorda tympani, you remember the chorda tympani nerve that runs in the let me show you here again, let me remind you, this is the I talked already about it, but let me make sure you got it. This is the chorda tympani nerve, already explained. You can go back to the video, but anyway, pass it between incus and malleus. Then look, this is in relation to tympanic membrane. It's located in the upper part. So if there is perforation, it's preferred to be in the inferior part of tympanic membrane, in the inferior part, right, of tympanic membrane, if there is a need to for a rupture, right? And also incision done below this level. And because, so like this, because the superior part also not about chorda tympanial but also highly vascular, so incision for release of the pus, if there is pus here or inflammation, done in the posterior inferior part of the membrane. You can read otitis media, how and really how it's connected with Eustachian tube and these clinical conditions. Thank you so much, and hope you find value in it. Thanks.